Hello everyone and welcome back to my channel. So I am back with another episode of Read Robbins with me, in which I'm going to address the chapter of cell injury, cell death and adaptations. So I'm not going to give any introduction before I start this chapter. For the introductory part and for the disclaimers, I would ask you to go back to the previous video and the video in which I've explained about how to read Robbins and why to read Robbins. So without further ado, I would dive straight into this chapter. So, starting with this chapter, this is the dictum which you must know, and that is whenever a cell is undergoing any kind of stress, initially there's going to be adaptation. Okay, like hypertrophy, hyperplasia, metaplasia, etc. And whenever this adaptation, the cell is inability to adapt, there is excessive amount of stimulus or injurious stimulus especially, so then only the cell will undergo cell injury. Again, if the cell injury is mild and transient, it will the cell will undergo reversible injury, and if it is severe and progressive, the cell will undergo irreversible injury. So necrosis and apoptosis are two forms of cell death. So you can say that whenever a short note will come on irreversible injury, you should always mention about necrosis and apoptosis, because that ultimately is the outcome of irreversible cell injury. Okay. So what is adaptations? Adaptations are reversible functional and structural responses to changes in physiological states and some pathological stimuli, during which new but altered steady state is achieved, allowing the cell to survive and continue to function. Cell injury is reversible up to a certain point, but if the injurious stimuli is persistent or severe, then there is irreversible injury and ultimately the cell undergoes cell death. Okay, so you must see, if you see this diagram, you will be able to understand that when there is an adaptation, the cell is undergoing hypertrophy. Okay, and this is the colored area, thus the transverse sections of the heart is being stained with triphenyl tetrazolium chloride, that is an enzyme substrate that colors the viable myocardium magenta. So still the cells are very much viable, and that is why this is magenta colored. This is the normal myocyte which is magenta colored. This is also magenta colored, but here you can see that there is no color, means this area the cell death has occurred. Okay, so whenever there is cell injury, when if it is a reversible injury, it's okay, but if there is cell death, then you will find that this tetrazolium chloride will not give the magenta color anymore. So this is the necrotic area. Okay, now there are two principal pathways of cell death. One is the necrosis and one is the apoptosis. Nutrient deprivation triggers an adaptive cellular response known as the autophagy that also may culminate in cell death. Now, this is a very, very important point in your MCQs. Okay, if you see this word called nutrient deprivation, then the answer is going to be a autophagy and not apoptosis. Okay, very important. If it is the nutrient deprivation, any kind, you anytime you find this word, please mark autophagy and not apoptosis. Although apoptosis is a very important pathway of cell death and autophagy is also an important pathway of cell death, but nutrient deprivation में सिर्फ autophagy होता है, apoptosis is a completely different phenomena. Now, so, what are the causes of cell injury? Very fast oxygen deprivation, in which you find there's hypoxia, and that leads to cardiorespiratory failure. Physical agents like mechanical trauma, extremes of temperature, sudden changes in atmospheric pressure, radiation, electric shock. Chemical agents and drugs like environmental pollutants, insecticides, etc. Then infectious agent, immunological reactions, and all of these genetic abnormalities, nutritional balances. All these are the causes of cell injury. Now, what is a reversible cell injury and what is irreversible cell injury? Irreversible cell injury is ultimately leading to cell death. So we are going to read two important points, that is the necrosis and apoptosis. We are going to read about this later. And also the cell injury is having different mechanisms like mitochondrial injury, then damage to plasma membrane and damage to cell DNA. All of this will come towards the end of this chapter. So that is how the chapter is arranged, and I'm going to go with the flow of Robbins only. Essentially, that last part should be done first to understand the concepts, but since I'm going with the flow of Robbins, I'm not going to skip my pages. So if you talk about the reversible injury, reversible cell injury is characterized by functional and structural alterations in early stages or mild forms of injury which are correctable if the damaged stimulus is removed. So if the stimulus is removed, the cell will return back to its original state. That is the reversible cell injury. So what happens is early alterations. Well, what are the changes? Number one is the generalized swelling of the cell. Why does this happens? Because this happens because of the failure of the ATP dependent sodium potassium plasma membrane pump due to depletion of ATP. You know that whenever there is cell injury, there is a reduction in the ATP, and because of this pump will not work anymore. And you know the function of this pump is to throw the sodium out, right? But when this pump is not functioning, the sodium will be retained inside the cell. And once, if this is the cell, and if sodium is entering the cell and is getting stored inside the cell, it will also draw water along with it, and therefore there's going to be swelling of the cell. So cell swelling is the one of the very initial changes you see in case of reversible cell injury. Next is the fatty change, which is seen in the organs that are actively involved in lipid metabolism, like the liver. Now, this chart is extremely important. I can't stress any more on this importance of the chart. So, in necrosis, you find that the cell size, I'm going to discuss it here itself only, although I haven't discussed apoptosis, but I'm going to put this forward here only because I'm going to go with the flow of Robbins. Understand that in case of necrosis, you find that the cell is getting swelled up, okay? But in apoptosis, there is no cellular swelling. There is in fact reduction in the cell size or shrinkage. Very important point. Next is in necrosis, the nucleus is undergoing pycnosis, karyohexis, and karyolysis. But in apoptosis, there is fragmentation into nucleosome size fragments, means it is completely getting fragmented. Because we know that what happens in apoptosis is apoptotic bodies are formed, okay, and the entire cell ultimately gets transformed into this apoptotic bodies ultimately before its destruction. But necrosis में ऐसा नहीं होता है. So therefore there is fragmentation in the apoptosis, especially in the nucleus. This is what is happening in the nucleus. The nucleus is getting completely fragmented over here, but here this the fragmentation doesn't happen. First is pycnosis, karyohexis, and karyolysis. Next is the plasma membrane. It is getting disrupted in case of necrosis, but it is intact in case of apoptosis. I just can't stress any more on the importance of this. Please understand, plasma membrane is intact, and once it is intact, therefore we can say that there is no inflammation. Very important, there is no inflammation in apoptosis, and there is the plasma membrane is absolutely intact in case of apoptosis, whereas the plasma membrane is disrupted in necrosis, and there is frequent adjacent inflammation in necrosis. Now, cellular contents, there's enzymatic digestion, and thus contents may leak out of the cell in case of necrosis. But because the cell is intact, therefore there is no release of any kind of cellular contents. But there may be apoptotic bodies released, as I said. So that is ultimately the important point to note here. Okay. So this is basically pathologic. Necrosis mainly happens, in pathological conditions, but but apoptosis, sometimes physiological conditions also give rise to apoptosis, because whenever there's cell damage, the cell itself wants to die. It's better that the cell dies rather than staying alive with those mutated genes. Okay. Now, this is a very important part. So, cellular swelling is the earliest manifestation of almost all forms of injury to the cells, except the apoptosis, where cell shrinkage is the first and earlier manifestation. So, I will repeat it. Cellular swelling is the earliest manifestation of any kind of cell injury, except apoptosis, where cell shrinkage is the earliest manifestation. What happens here is that because there is cellular swelling, there is appearance of small clear vacuoles in the cytoplasm, and this kind of non-lethal injury is known as the hydropic change or vacuolar degeneration, because there is formation of small vacuoles due to the increase in cellular swelling. And the cytoplasm of these cells will appear red, means it is eosinophilic, okay, when stained with the HNA stain, because of the loss of RNA usually binds to the blue hematoxylin dye and therefore gives the appearance of a blue color. But because there is loss of RNA here now, therefore the cell will appear eosinophilic or red in color. Okay. Now, the ultrastructural changes of reversible cell injury are these, very important. So, plasma membrane alterations like blebbing, blunting, and loss of microvilli, mitochondrial changes like swelling and appearance of the small amorphous densities, accumulation of myelin figures, very important. It is present in the reversible and cell and irreversible injury in both is present. Okay, these are basically the phospholipids which are derived from the damaged cellular membranes. Next is the dilatation of the ER with the detachment of the polysomes, nuclear alterations with disaggregation of granular and fibrillar elements. So all these things, they come in the short note in the MCQs and everywhere. So very important. Now coming to the cell death, I'm going to discuss these two mechanisms here. That is the apoptosis and the necrosis. I'm just going to go through this image and tell you that please understand. In the necrosis, you have this amorphous densities in the mitochondria, but in apoptosis you rather have the apoptotic body. And if you talk about the myelin figures, see this image is about the reversible injury. Up to this point the cell is undergoing reversible injury, and if there is progressive stimuli, progressive injury, then this is the figure of irreversible cell injury or necrosis. So you can see that myelin figure is present in both of them, but plasma membrane blebs is present only in case of reversible injury and not in case of irreversible injury. I hope that makes sense to you. Okay, so you can see that this is a necrotic area, and this one is the apoptosis, because you can see these apoptotic bodies which are being broken down from the cells, ultimately leading to cell fragmentation. Okay, and next, and at the end you will have this phagocytosis of these apoptotic cells and the fragments. So this image you can see here that this is the normal kidney tubule. Okay, this is the early reversible ischemic injury which is showing the surface blebs, increased eosinophilia of the cytoplasm, and the swelling of the occasional cells. And this is the necrosis. You can see here that there's loss of nuclei. You can't see any nuclei over here. There's loss of nuclear fragmentation of the cells and leakage of the contents. So this is just an overview. This is the electron microscopy image. So nowadays, images are directly asked from Robbins as well. So please go to these images. If you just listen to this video, it will get imprinted in your mind and you don't have to again read this. So this is a markedly swollen mitochondria containing electron dense deposits expected to contain precipitated calcium and proteins. Okay, so you can see this image आएगा तो ये होगा तुम्हारे लिए swollen mitochondria containing electron dense deposits. Okay, now necrosis. Yes, so necrosis में क्या होता है? Necrosis is characterized by denaturation of the cellular proteins, leakage of the cellular contents through damaged membranes, local inflammation, and enzymatic digestion of the lethally injured cell. So all of these are very important points, very important for MCQ and for your short notes. So when there is a damage to the membrane is severe, the lysosomal enzymes will enter the cytoplasm and will damage the cell. And the cellular contents will also leak to the damaged plasma membrane, where they will elicit an inflammation. And the specific substances which are released from these injured cells are now known as the damage associated molecular pattern, or these DAMPs. Now what are the examples of these DAMPs? These are ATP, uric acid, and numerous other molecules. So once there is a damage, okay, and once these kind of molecules they come out into the extracellular space, they can now be used to measure what kind of injury has happened. So necrosis associated leakage of these intracellular proteins through these damaged plasma membranes and ultimately into circulation is the basis for a number of blood tests which will detect the tissue specific cellular injury. Like in case of myocardial infarction, you can see this cardiac specific troponins which appear in the blood. Okay, so this is basically how necrosis is happening. It is basically happening because of this denaturation of the proteins, and there's inflammation, and there is breakdown of the cellular membrane, and all of it. So what is the morphology? You can see that necrotic cells show increased eosinophilia. Very, very important point to note. Important question. Increase in eosinophilia is seen in the necrosis. Okay, and the necrotic cells, they have a glassy homogeneous appearance. Okay, because of the result of the loss of glycogen particles. Because of this, there's a glassy homogeneous appearance. The cytoplasm becomes vacuolated and appears moth-eaten. Now, why I told that this is very important is that you will very much get confused over here. I'm going to come to it later. First, understand that these words are very important. Okay, so the cytoplasm is having a moth-eaten appearance. The dead cells may be replaced by large whorled phospholipid precipitates known as the myelin figures. Now, electron microscopy. Please be very careful in your MCQ based exams that they sometimes ask you features of light microscopy, and they also ask you features of electron microscopy. If it is electron, क्या पूछ रहे हैं वो आपको अच्छे से देखना पड़ेगा. If it is electron microscopy, then you know that the answer will be different. Okay, so in the EM you find that these cells are characterized by discontinuities in plasma and organelle membranes, marked dilatation of the mitochondria with appearance of the myelin figures, which is the large amorphous densities, intracytoplasmic myelin figures, amorphous debris, and aggregates of fluffy material representing the denatured proteins. So all these are found in the electron microscopy. Very important points. Okay, now, nuclear changes, as I said, there's going to be karyolysis, which is the loss of the DNA, pycnosis, which is the nuclear shrinkage and increase in basophilia, and karyohexis, which is ultimately the fragmentation. So please understand, very importantly, the chromatin here is getting condensed into a dense shrunken basophilic mass. So if in the exam you find the word eosinophilia, do not mark it as necrosis, because necrosis cells they do show eosinophilia, लेकिन MCQ में ये आप मार्क नहीं कर सकते. MCQ में आपको मार्क करना है basophilic mass. Okay, because eosinophilia will be present. Eosinophilic mass is formed in case of apoptosis. Okay, if I can just compare it, it will be easy for you. See, this is the apoptosis ka morphology. Okay, this is clearly mentioned here that in the HNE stained tissue, the apoptotic cell will appear as a mass of intensely eosinophilic cytoplasm with dense nuclear chromatin. So whenever in the exam you find the word eosinophilic, your answer is going to be apoptosis, and whenever you find the word basophilic, your answer will be necrosis. Okay, therefore this is a very very important. Here it is written eosinophilia, yes होता है शुरू में, लेकिन last में is getting converted into basophilic mass because the chromatin is getting condensed over here, which is not the mechanism of apoptosis. ठीक है, तो बेसोफिलिया देखेंगे तो हम लोग मार्क करेंगे निक्रोसिस, और eosinophilic mass देखेंगे तो मार्क करेंगे apoptosis. ये डिफरेंस जो है ये बहुत ही सटल डिफरेंस है जो आपको नोट करना है. Now, so there's two phenomena happening here, and that is the inability to reverse mitochondrial dysfunction and the profound disturbances in membrane function. So let's come to the different types of necrosis. Very very important, these images. I'm not going to go through these images because you just have a look at these images. This is a coagulative necrosis, and you can see this area. This entire area is showing necrosis, especially the coagulative necrosis, which is having a preserved cellular outline with loss of nuclei and an inflammatory infiltrate. So you can see that the membrane is preserved, but the outer architecture is preserved, but there is a loss of nuclei. So what happens in coagulative necrosis is the most common form in which the architecture of the dead tissue is preserved, and the injury denatures not only the structural proteins but also the enzymes. As a result, there's a formation of intensely eosinophilic cells. So ischemia may occur, and in all the solid organs except the brain, there is formation of coagulative necrosis. A localized area of coagulative necrosis is called as an infarct, but in the brain you only and specifically find the liquefactive necrosis, in which there is digestion of the dead cells, resulting in transformation of the tissue into a viscous liquid. There's some kind of bacterial and fungal infections here, so you see this accumulation of the leukocytes and liberation of the enzymes. There's formation of the pus. Okay, so that is what is happening in the CNS and especially the brain. Now gangrenous necrosis, another type, and you have this caseous necrosis, where in the center you find this caseous cheese-like material surrounded by the other distinct color of inflammatory cells and all these granular debris and fragments, and this is the granuloma. सो ग्रैन्युलोमा इज अ वेरी इंपॉर्टेंट शॉर्ट नोट, जिसका आर्किटेक्चर यहाँ पर इतने अच्छे तरीके से नहीं दिया हुआ है. इट्स नॉट गिवन वेरी नाइसली हियर दैट द एग्जैक्ट फॉर्मेशन ऑफ ग्रैन्युलोमा. व्हेन यू फाइंड इन द सेंटर you have caseous necrosis, then you have a surrounding epithelioid cells, then you have lymphocytes, and you have all of those inflammatory infiltrates. So that is a different question. It is not given very nicely over here. So this is the fibrinoid necrosis. As you can see, there is deposition of fibrin in the walls of the arteries. Okay, so yes, so fat necrosis is happening in the especially in case of acute pancreatitis, where because of the activated pancreatic lipases, the fatty acids are generated that combine with calcium to form chalky white areas known as fat saponification. Fibrinoid necrosis is found in the vascular damage usually seen in immune complex reactions involving the blood vessels, in which the immune complexes are getting deposited in the walls of the arteries as a bright pink fibrinoid like material. So these are very easy, there's nothing much hard to understand, but you just have to remember all of this because any kind of question can be asked from here. These topics are very, very important.